Question 1. A resident with chronic kidney disease on a strict fluid restriction of 1,000 milliliters per 24 hours frequently complains of extreme thirst and is becoming agitated. What is the CNA's most therapeutic and responsible action? A. Offer the resident a full glass of water discreetly to calm them. B. Report the resident's extreme thirst and agitation to the nurse immediately, offering frequent oral hygiene. C. Tell the resident firmly that no more fluids are allowed, and document their noncompliance. D. Distract the resident with a favorite activity, avoiding any mention of fluids. Answer: B. Report the resident's extreme thirst and agitation to the nurse immediately, offering frequent oral hygiene. This question tests a CNA's ability to manage complex resident needs under strict medical orders. The keywords extreme thirst and agitation in a resident on strict fluid restriction indicate significant distress and a potential escalation if not addressed appropriately. The most therapeutic and responsible action is to report these symptoms to the nurse immediately, as the nurse can assess for medical reasons for the increased thirst or consider adjustments to the care plan, while also providing frequent oral hygiene, like moist sponge swabs, to alleviate dryness. Providing unauthorized fluids or simply dismissing their distress is unsafe and unethical. Always report persistent distress and symptoms related to fluid restrictions to the nurse and offer comfort within guidelines. Question 2. A certified nursing assistant, CNA, is assisting a resident with moderate cognitive impairment to dress. The resident becomes agitated and tries to take off their clothes, stating, "These are not my clothes." What is the CNA's most therapeutic and safe intervention? A. Firmly state that the clothes are theirs and they must wear them. B. Stop dressing, offer a choice of 2 different, familiar outfits, and try again in a few minutes. C. Force the clothes onto the resident quickly to complete the task. D. Document the noncompliance and move on to another task, leaving the resident undressed. Answer: B. Stop dressing, offer a choice of 2 different, familiar outfits, and try again in a few minutes. This question addresses managing challenging behaviors in residents with cognitive impairment during personal care. When a resident becomes agitated and insists clothes are not theirs, the most therapeutic and safe intervention is to stop dressing, gently offer choices, which can restore a sense of control, and try again after a short break. Forcing care or arguing increases agitation and distress. Offering familiar items can help reduce confusion and resistance. Always offer choices and use gentle redirection for cognitively impaired residents who resist personal care. Question 3. A resident with a newly inserted colostomy requires ostomy care. The resident expresses fear and reluctance to look at the stoma, the surgically created opening, or participate in changing the pouch. What is the CNA's most appropriate first response? A. Tell the resident there's nothing to be afraid of, as it's a routine procedure. B. Encourage the resident to look, explaining that early involvement is important for self-care. C. Acknowledge their feelings of fear and reluctance, offer privacy, and gently explain the step-by-step process of changing the pouch. D. Ask the nurse to perform all future ostomy care until the resident is more comfortable. Answer: C. Acknowledge their feelings of fear and reluctance, offer privacy, and gently explain the step-by-step process of changing the pouch. This question tests therapeutic communication and person-centered care for a resident coping with a new body image and medical procedure. When a resident expresses fear and reluctance to look at the stoma, the most appropriate first response is to acknowledge and validate their feelings, e.g., "It's normal to feel that way." Then, offer maximum privacy and gently explain the process of changing the pouch step by step, providing information and control without forcing participation. Dismissing their fear or forcing interaction is untherapeutic. Always validate feelings and provide gradual, respectful education for residents adjusting to new medical conditions or procedures. Question 4. A CNA observes a resident's pressure injury on their sacrum, previously documented as a stage 2, partial skin loss, has now deepened to exposed muscle tissue. What is the most accurate classification of this finding? A. Stage 2 pressure injury, no change. B. Stage 3 pressure injury. C. Stage 4 pressure injury. D. Unstageable pressure injury. Answer: C. Stage 4 pressure injury. This question tests advanced knowledge of skin assessment and pressure injury classification. The progression from a stage 2, partial skin loss, to an injury that now deepened to exposed muscle tissue is the definitive sign of a stage 4 pressure injury. Stage 4 involves full-thickness tissue loss with exposed bone, tendon, or muscle, which are clearly deeper structures than subcutaneous fat. This is a critical finding that requires immediate reporting to the nurse for urgent assessment and intervention. Always recognize exposed bone, tendon, or muscle as a stage 4 pressure injury. Question 5. A resident has an order for strict NPO except for sips of water Q2H for dry mouth. The resident is alert and oriented and requests a full glass of water. What is the CNA's most appropriate response? A. Provide the full glass of water, as the resident is alert and can make their own choices. B. Explain the order's specific limit, offer the allowed sips of water, and provide frequent oral hygiene. C. Tell the resident they are not allowed any water, only medication. D. Document the request and allow the resident to call the nurse. Answer: B. Explain the order's specific limit, offer the allowed sips of water, and provide frequent oral hygiene. This question tests strict adherence to a precise, modified NPO order and compassionate patient education. The order specifies sips of water Q2H every 2 hours, for dry mouth but not a full glass. The most appropriate response is to clearly explain this precise limit to the resident, offer only the allowed sips of water as prescribed, and provide frequent oral hygiene, like moist sponge swabs, to manage their thirst. Providing a full glass of water would violate the medical order and risk complications. Always adhere precisely to modified NPO orders and use approved comfort measures for thirst. Question 6. A CNA accidentally charts vital signs for Resident A into Resident B's electronic health record, EHR. What is the correct and most ethical procedure to rectify this error? A. Delete the incorrect entry from Resident B's chart and re-enter into Resident A's chart. B. Make a new entry in Resident B's chart stating error entered in wrong chart, then document the correct vital signs in Resident A's chart. C. Use the amend or correct function in the EHR for Resident B's entry, clearly stating it's for Resident A, and then create a new entry for Resident A. D. Inform the nurse to verbally correct the mistake during rounds. Answer: C. Use the amend or correct function in the EHR for Resident B's entry, clearly stating it's for Resident A, and then create a new entry for Resident A. This question addresses a critical aspect of legal and ethical documentation in an electronic health record, EHR. When an entry is made under the wrong resident's name, the correct and most ethical procedure is to use the specific amend or correct function within the EHR system for the incorrect entry in Resident B's chart. This action typically retains the original incorrect entry but marks it as erroneous and allows a note to be added explaining the mistake and directing to the correct chart for Resident A, then a new, correct entry is made for Resident A. This preserves an auditable trail, which is crucial for legal and accountability purposes. Deleting or overriding entries is unacceptable. Always use the proper amendment function in the EHR to correct errors transparently. Question 7. A resident is on a complex repositioning schedule every 90 minutes for pressure injury prevention and uses a specialized low air loss mattress. The CNA observes the mattress has a visible tear and is losing air. What is the CNA's immediate action? A. Continue the repositioning schedule and patch the mattress later. B. Place extra pillows under the resident's bony prominences. C. Immediately increase the frequency of repositioning and report the damaged mattress to the nurse. D. Transfer the resident to a different bed with a functioning mattress. Answer: C. Immediately increase the frequency of repositioning and report the damaged mattress to the nurse. This question tests critical thinking regarding equipment failure and proactive resident care. The keywords visible tear and losing air in a specialized low air loss mattress mean a key preventative device is compromised. The immediate action is to increase the frequency of repositioning, e.g., to hourly or more often, because the resident no longer has the benefit of the specialized mattress's pressure redistribution. Simultaneously, report the damaged mattress to the nurse, who needs to address the equipment repair or replacement and reassess the resident's skin. Simply using pillows or moving beds without nursing direction is insufficient. Always adjust care immediately when preventative equipment fails, and report the issue to the nurse. Question 8. A resident with a nasogastric (NG) tube receiving continuous feeding complains of nausea and severe abdominal cramping. The CNA notes the resident has not had a bowel movement in 3 days. What is the CNA's most critical first action after ensuring immediate safety? A. Measure the abdominal girth and document it. B. Administer a PRN laxative through the NG tube as ordered. C. Stop the continuous feeding immediately and report all observations to the nurse. D. Encourage the resident to ambulate to stimulate bowel activity. Answer: C. Stop the continuous feeding immediately and report all observations to the nurse. This question assesses prioritization in a complex scenario involving tube feeding, gastrointestinal distress, and elimination issues. The combination of nausea and severe abdominal cramping with no bowel movement in 3 days in a resident receiving continuous feeding are strong indicators of potential constipation, impaction, or paralytic ileus, which can be exacerbated by ongoing feeding. The most critical first action is to stop the continuous feeding immediately to prevent further gastrointestinal distress or aspiration, and then report all observations to the nurse without delay. Administering laxatives is outside the CNA's scope. For example, you would clamp the feeding tube and immediately alert the nurse, describing the symptoms. Always stop tube feedings and report signs of severe gastrointestinal distress and prolonged absence of bowel movements to the nurse immediately. Question 9. What is the primary purpose of routinely applying anti-embolism stockings, TED hose, to a resident's legs? A. To reduce existing edema, swelling, in the legs. B. To prevent muscle atrophy during periods of immobility. C. To promote venous blood flow back to the heart and prevent deep vein thrombosis, DVT. D. To keep the resident's legs warm and comfortable. Answer: C. To promote venous blood flow back to the heart and prevent deep vein thrombosis, DVT. This question tests essential knowledge about a common therapeutic device. The primary purpose of applying anti-embolism stockings, TED hose, is to promote venous blood flow back to the heart and prevent deep vein thrombosis, DVT, which are dangerous blood clots in the deep veins, especially in the legs. The stockings apply graduated compression, which gently squeezes the veins to help blood flow more efficiently and prevent it from pooling, thereby significantly reducing the risk of clot formation. While they can sometimes help reduce existing swelling, their main medical goal is DVT prevention. Always remember that TED hose are primarily for DVT prevention and improving circulation. Question 10. A resident with a new onset of severe headache, blurred vision, and sudden difficulty speaking, dysarthria, is suspected of having a stroke. The nurse asks the CNA to monitor the resident closely. What is the most important specific observation for the CNA to make every 15 minutes? A. Resident's pain level on a scale of 0 to 10. B. Resident's ability to move all four extremities equally and facial symmetry. C. Resident's appetite and fluid intake. D. Resident's skin color and temperature. Answer: B. Resident's ability to move all four extremities equally and facial symmetry. This question tests critical observation skills for a suspected medical emergency, requiring focused neurological assessment. The keywords severe headache, blurred vision, and sudden difficulty speaking, dysarthria. In a suspected stroke case, highlight acute neurological changes. The most important specific observation every 15 minutes is the resident's ability to move all four extremities equally and facial symmetry. These observations directly assess for worsening neurological deficits, e.g., paralysis, facial droop, which are crucial indicators of stroke progression and require immediate reporting. Other vital signs or general observations are less specific to stroke assessment. Always focus on neurological signs when monitoring for stroke progression. Question 11. What is the most crucial step in preventing cross-contamination when handling a soiled linen bag from a resident on strict isolation precautions? A. Place the soiled linen bag directly on the floor outside the resident's room for pickup. B. Double bag the soiled linen inside the resident's room before removal. C. Wear gloves when handling the outer bag, but a gown is not necessary. D. Transport the soiled linen bag with other clean linens to save time. Answer: B. Double bag the soiled linen inside the resident's room before removal. This question tests critical infection control protocol, specifically for handling contaminated items from isolation. To prevent cross-contamination from soiled linen from a resident on strict isolation precautions, the most crucial step is to double bag the soiled linen inside the resident's room. This means placing the soiled linen into one bag, then sealing it and placing that bag into a second, clean bag, usually held by another staff member, all within the isolation room. This technique ensures the outer bag remains clean during transport, preventing the spread of microorganisms to the environment. Always double bag soiled items from isolation rooms. Question 12. A CNA is assisting a resident with moderate cognitive impairment during a bed bath. The resident consistently attempts to eat the soap. What is the CNA's most appropriate adjustment to care? A. Allow the resident to hold a small piece of soap, as it provides sensory stimulation. B. Firmly tell the resident that soap is not food and remove it immediately. C. Use a no-rinse bathing product or soap substitute, and keep all soap products out of reach. D. Document the behavior and report it to the nurse for a behavioral plan. Answer: C. Use a no-rinse bathing product or soap substitute, and keep all soap products out of reach. This question tests adapting personal care for a resident with cognitive impairment and unsafe behaviors. When a resident consistently attempts to eat the soap, the most appropriate adjustment is to use a no-rinse bathing product or a liquid soap substitute and, crucially, to keep all soap products out of the resident's reach. This proactive environmental modification prevents them from consuming an unsafe item while still ensuring hygiene. Firmly telling them no is often ineffective for cognitive impairment, and allowing them to hold soap is unsafe. Always prioritize safety by removing unsafe items and adapting products when a resident attempts to eat non-food items. Question 13. A resident with severe peripheral neuropathy, nerve damage, leading to reduced sensation, in their lower extremities needs a foot soak. What is the most critical safety measure for the CNA to take regarding the water temperature? A. Ask the resident to test the water temperature with their fingers. B. Use the facility's standard hot water setting, as it's pre-regulated. C. Always use a bath thermometer to ensure the water is comfortably warm, between 100 to 105 degrees Fahrenheit, 38–41 degrees C. D. Make the water slightly hotter than usual, as they may not feel the warmth. Answer: C. Always use a bath thermometer to ensure the water is comfortably warm, between 100 to 105 degrees Fahrenheit, 38–41 degrees C. This question addresses critical safety during personal care for residents with impaired sensation. The keyword severe peripheral neuropathy means the resident has a reduced ability to feel temperature, making burns a significant risk even at temperatures that feel normal to a CNA. Therefore, the most critical safety measure is to always use a bath thermometer to precisely verify the water temperature is within the safe, comfortably warm range of 100 to 105 degrees Fahrenheit, 38–41 degrees C, before their feet enter it. Relying on their sensation or standard settings is unsafe. For example, a resident might not feel the water is too hot until a burn has already occurred. Always use a thermometer to confirm water temperature for residents with impaired sensation to prevent burns. Question 14. A resident is typically very active and independent but has become withdrawn, refuses to participate in activities, and spends most of the day in bed, often crying. What is the CNA's most appropriate first action? A. Tell the resident to snap out of it and encourage them to socialize. B. Document the changes in behavior and activity level, and report them to the nurse immediately. C. Immediately call the resident's family to inform them of the changes. D. Force the resident to get out of bed and attend a group activity. Answer: B. Document the changes in behavior and activity level, and report them to the nurse immediately. This question tests critical thinking in recognizing significant changes in a resident's emotional and activity status. A resident becoming withdrawn, refuses to participate, spends most of the day in bed, often crying, is a significant change in behavior and activity level. The most appropriate first action is to document these observations meticulously and report them to the nurse immediately. These symptoms could indicate depression, a medical issue, or other psychological distress requiring professional assessment and intervention. Forcing activities or calling family without nursing assessment is inappropriate. For example, you would tell the nurse, Mrs. Smith is very withdrawn today and has been crying, which is unusual for her. Always report significant changes in mood, activity, or behavior to the nurse immediately. Question 15. A resident has an order for strict bed rest and has anti-embolism stockings, TED hose, applied. What is the most important specific observation the CNA should report to the nurse regarding the TED hose? A. The resident complains the stockings feel tight. B. The stockings are rolled down below the knee. C. The resident's toes are slightly cold. D. The stockings have been applied for over 24 hours. Answer: B. The stockings are rolled down below the knee. This question tests critical observation related to a therapeutic device for DVT prevention. If anti-embolism stockings, TED hose, are rolled down below the knee, it is the most important observation to report because this creates a tourniquet effect, restricting blood flow and potentially increasing the risk of deep vein thrombosis, DVT, rather than preventing it. TED hose must be smooth and unrolled to provide even graduated compression. While tightness or cold toes are concerns that might need assessment, a rolled-down stocking is a direct hazard. For example, you would find the nurse and say, "Mr. Smith's TED hose are rolled down to his calves." Always report immediately if TED hose are rolled down, as it can be dangerous. Question 16. A CNA measures a resident's blood pressure and obtains a reading of 88/50 mmHg. The resident appears pale and reports dizziness. What is the CNA's immediate action? A. Reassure the resident that a low blood pressure is normal for some individuals. B. Offer the resident a glass of juice or a sugary snack. C. Report the low blood pressure and symptoms to the nurse immediately, and assist the resident to lie down. D. Retake the blood pressure on the same arm in 15 minutes. Answer: C. Report the low blood pressure and symptoms to the nurse immediately, and assist the resident to lie down. This question tests critical thinking and immediate intervention for an abnormal vital sign and associated symptoms. A blood pressure of 88/50 mmHg is significantly low, hypotension, and the resident appearing pale and reporting dizziness indicates symptomatic hypotension, which can lead to fainting or falls. The immediate action is to report the low blood pressure and symptoms to the nurse immediately, and concurrently assist the resident to lie down to improve blood flow to the brain and prevent a fall. Offering juice or delaying reporting is inappropriate. For example, you would help them lie flat and tell the nurse, "Mrs. Jones's BP is 88/50, she's pale and dizzy." Always report low blood pressure with symptoms to the nurse immediately and ensure the resident's safety. Question 17. What is the most effective way for a certified nursing assistant, CNA, to communicate with a resident who has receptive aphasia, difficulty understanding spoken language? A. Speak loudly and quickly to get their attention. B. Use complex sentences and detailed explanations. C. Use simple, short phrases, gestures, and visual aids, and speak slowly. D. Ask multiple open-ended questions to encourage expression. Answer: C. Use simple, short phrases, gestures, and visual aids, and speak slowly. This question addresses therapeutic communication for residents with specific communication barriers. For a resident with receptive aphasia, difficulty understanding, the most effective way to communicate is to use simple, short phrases, speak slowly, incorporate gestures, and use visual aids, like pictures or pointing to objects. This approach minimizes cognitive load and provides multiple cues to aid comprehension. Speaking loudly, quickly, or using complex sentences will only increase confusion and frustration. For example, you might say, "Eat," while pointing to food, and wait for a response. Always use simple, multimodal communication when a resident has difficulty understanding spoken language. Question 18. A resident on strict bed rest develops a red, non-blanchable area on their heel. The nurse has applied a specialized heel protector. The CNA continues with the 2-hour turning schedule. 3 days later, the CNA observes the skin in the reddened area has now opened into a shallow ulcer. What is the most likely cause of this progression? A. Inadequate application of lotion to the skin. B. Continued unrelieved pressure on the heel. C. The heel protector was applied too tightly. D. the resident has a poor nutritional intake. Answer B. Continued unrelieved pressure on the heel. This question tests critical thinking about pressure injury etiology. The progression from a red, non-blanchable area, stage 1, to a shallow ulcer, stage 2, despite a heel protector and a 2-hour turning schedule, strongly indicates continued unrelieved pressure on the heel. While nutrition is a factor in healing, the immediate cause of progression is usually sustained pressure that compromises blood flow. The heel protector or turning schedule might be insufficient for this resident's specific needs, or applied incorrectly, but the underlying problem is pressure. For example, even with a protector, if the heel still bears weight consistently, it can break down. Always reevaluate interventions if skin breakdown progresses, as unrelieved pressure is the primary cause. Question 19. A resident's spouse approaches the CNA and states their husband, the resident, has become very withdrawn and rarely leaves his room, which is unusual. The spouse asks if the CNA has noticed anything concerning. What is the CNA's most appropriate response? A. Reassure the spouse that withdrawal is common in nursing homes. B. Confirm the observation and state, yes, he seems depressed. C. Listen attentively to the spouse's concerns, state that observations will be reported to the nurse, and avoid discussing specific details about the resident. D. Advise the spouse to bring more stimulating activities for the resident. Answer C. Listen attentively to the spouse's concerns, state that observations will be reported to the nurse, and avoid discussing specific details about the resident. This question addresses professional communication with family and maintaining confidentiality. When a spouse expresses concern about a resident's unusual withdrawal, the most appropriate response is to listen attentively to their concerns. Then, professionally state that you will ensure all observations are reported to the nurse, while avoiding discussion of specific resident details, due to HIPAA. CNAs do not diagnose depression or advise interventions. The nurse will assess and plan care. For example, you would say, "Thank you for sharing your concerns. I will be sure to report all of this to the nurse for her assessment." Always listen respectfully to family concerns but maintain resident confidentiality. Question 20. A resident is diagnosed with a highly contagious respiratory infection, requiring droplet precautions. When entering the resident's room for routine care, which personal protective equipment, PPE, is essential for the certified nursing assistant, CNA, to wear? A. N95 respirator mask. B. Gown and gloves. C. Surgical mask. D. Eye protection and face shield. Answer C. Surgical mask. This question tests critical knowledge of infection control, specifically essential PPE for highly contagious respiratory infections spread by droplets. 4. Droplet precautions, which are used for diseases spread through large respiratory droplets, for example, influenza, some types of pneumonia. A surgical mask is essential when within 3 feet of the resident or entering their room. This helps block the transmission of droplets. While gowns and gloves may be added for specific tasks involving fluid contact, the surgical mask is the primary PPE for droplet-borne illnesses. For example, you would don a surgical mask before opening the door to their room. Always wear a surgical mask for droplet precautions. Question 21. When taking a resident's radial pulse, the certified nursing assistant, CNA, notes the pulse is very weak and thready. What is the CNA's most appropriate action? A. Immediately report the weak and thready pulse to the nurse. B. Retake the pulse on the other wrist for 15 seconds. C. Document the pulse as normal if the rate is within range. D. Encourage the resident to walk around to improve circulation. Answer A. Immediately report the weak and thready pulse to the nurse. This question tests critical observation and immediate reporting of abnormal vital signs. A pulse described as very weak and thready is a significant abnormal finding, indicating potentially compromised circulation or a medical emergency, even if the rate is within normal range. The most appropriate action is to immediately report this observation to the nurse. This requires urgent professional assessment to determine the underlying cause and intervene. Retaking briefly or encouraging walking is insufficient. For example, you would tell the nurse, "Mr. Smith's radial pulse is very weak and thready, even though the rate is 80. Always report a weak or thready pulse to the nurse immediately." Question 22. A certified nursing assistant, CNA, is preparing bath water for a resident with compromised skin integrity due to an open wound on their leg. What is the most critical temperature consideration for the bath water? A. Ensure the water is slightly hotter than normal to thoroughly clean the wound. B. Rely on the resident to confirm the water temperature is comfortable. C. Use a bath thermometer to ensure the water is comfortably warm, between 100 to 105 degrees Fahrenheit, 38–41 degrees C, and test it carefully. D. Make the water slightly cooler than usual to avoid discomfort to the wound. Answer C. Use a bath thermometer to ensure the water is comfortably warm, between 100 to 105 degrees Fahrenheit, 38–41 degrees C, and test it carefully. This question addresses critical safety during personal care for residents with vulnerable skin. For a resident with compromised skin integrity and an open wound, burns are a significant risk. The most critical temperature consideration is to always use a bath thermometer to precisely verify the water temperature is within the safe, comfortably warm range of 100 to 105 degrees Fahrenheit, 38–41 degrees C, and to test it carefully yourself. Relying solely on the resident's perception is unsafe, as their sensation might be impaired around the wound or due to underlying conditions. For example, hot water can damage fragile tissue. Always meticulously verify bath water temperature with a thermometer for residents with compromised skin. Question 23. A CNA needs to collect a random urine specimen from a resident. What is the most important instruction to give the resident to ensure proper collection? A. Drink a large amount of fluid immediately before voiding. B. Cleanse the perineal area thoroughly with antiseptic wipes before voiding. C. Void into a clean bedpan, urinal, or commode hat. D. Collect the specimen first thing in the morning only. Answer C. Void into a clean bedpan, urinal, or commode hat. This question tests specific procedural knowledge for specimen collection. For a random urine specimen, the most important instruction is simply to void into a clean bedpan, urinal, or commode hat. Unlike a clean catch or timed specimen, a random sample does not require special cleansing, like antiseptic wipes, specific timing, or discarding of initial voids. The goal is simply to obtain any urine sample in a clean container. For example, you would provide them with a clean hat for the toilet. Always ensure the resident voids into a clean receptacle for a random urine specimen. Question 24. A resident with known severe dysphagia, difficulty swallowing, consistently tries to remove their own thickened liquid from a cup, leading to spills and choking risks. What is the CNA's most appropriate safety intervention? A. Restrain the resident's hands to prevent them from reaching the cup. B. Offer thin liquids from a straw, as it is easier to control. C. Offer thickened liquids from a specialized cup with a lid and small opening, and assist as needed. D. Document the behavior and report it to the nurse for a behavioral plan. Answer C. Offer thickened liquids from a specialized cup with a lid and small opening, and assist as needed. This question tests practical safety interventions for residents with severe dysphagia and challenging behaviors. If a resident with severe dysphagia is attempting to remove their own thickened liquid and creating a choking risk, the most appropriate safety intervention is to offer thickened liquids from a specialized cup with a lid and a small opening, and to assist as needed. This controls the flow of liquid, preventing spills and reducing aspiration risk while promoting independence. Restraining or offering thin liquids is unsafe. For example, a nosy cup or a cutout cup might be beneficial. Always use adaptive equipment and provide assistance for residents with dysphagia to drink safely. Question 25. A facility is experiencing a severe thunderstorm with frequent lightning strikes and a partial power outage. What is the CNA's most critical first action for residents in their assigned area? A. Encourage residents to gather in the hallway for safety. B. Close resident room doors and draw curtains, moving residents away from windows. C. Ensure all residents have battery-operated radios for entertainment. D. Call emergency services, 911, on your personal phone to report the outage. Answer B. Close resident room doors and draw curtains, moving residents away from windows. This question tests critical emergency preparedness for a severe weather event like a thunderstorm with lightning. The most critical first action for residents is to close resident room doors, to provide a barrier, and draw curtains, moving residents away from windows, to protect them from shattering glass or flying debris. This creates an immediate safer environment within their rooms. Gathering in hallways might be dangerous depending on the facility layout, and calling 911 or providing radios are secondary. For example, you would quickly close the door and help residents move to an inner wall away from the window. Always prioritize immediate protection from environmental hazards during severe weather. Question 26. A resident with moderate visual impairment is ambulating with a single-point cane in the dining room but frequently bumps into chairs. What is the most appropriate proactive intervention for the CNA to suggest? A. Recommend the resident eat meals in their room to avoid obstacles. B. Rearrange the dining room furniture to create wider pathways. C. Encourage the resident to use a rolling walker instead of a cane. D. Offer your arm for guidance when the resident is in the dining room, providing verbal cues. Answer D. Offer your arm for guidance when the resident is in the dining room, providing verbal cues. This question addresses balancing independence with safety for a resident with sensory impairment. If a resident with moderate visual impairment is frequently bumping into chairs in the dining room, the most appropriate proactive intervention is to offer your arm for guidance, walking slightly ahead, while providing clear verbal cues about upcoming obstacles. This provides immediate safety and support, allowing the resident to continue participating in social activities. Restricting them to their room is inappropriate, and suggesting a different device or rearranging furniture requires professional assessment beyond the CNA's scope. For example, you would gently approach and say, "Mr. Smith, may I offer you my arm to guide you to your seat?" Always offer immediate guidance and support when a visually impaired resident is ambulating unsafely. Question 27. A resident with advanced Alzheimer's disease consistently asks, "Where is my mother?" and becomes agitated when staff attempt to reorient them to reality. What is the CNA's most therapeutic and person-centered intervention? A. Gently remind the resident that their mother is deceased and cannot visit. B. Engage the resident in a conversation about their mother, validating their feelings, and then redirect to a calming activity. C. Ignore the question to avoid upsetting the resident further. D. Immediately call the nurse to report the resident's disorientation. Answer B. Engage the resident in a conversation about their mother, validating their feelings, and then redirect to a calming activity. This question addresses therapeutic communication for residents with advanced dementia experiencing disorientation. When a resident consistently asks, "Where is my mother?" and becomes agitated with reorientation, the most therapeutic and person-centered intervention is to engage them in a conversation about their mother, validating their feelings, e.g., "You miss your mother very much." Then, gently redirect to a calming activity or a positive memory. This approach acknowledges their emotional reality without confronting them with a factual truth that causes distress. Forcing reality or ignoring them is untherapeutic. For example, you might say, "It sounds like you loved your mother very much. Tell me about her favorite flower," then offer a gentle hand massage. Always validate feelings and gently redirect, avoiding reality orientation for agitated residents with advanced dementia. Question 28. A resident is on strict fluid restriction of 1,000 milliliters per 24 hours due to heart failure. The CNA notes the resident has consumed 800 milliliters by breakfast. The resident is now actively demanding more fluids. What is the CNA's most responsible action? A. Provide the resident with a small glass of water to prevent agitation. B. Firmly inform the resident they have no more fluids for the entire day. C. Report the resident's rapid fluid intake and demand to the nurse immediately, offering frequent oral hygiene. D. Document the resident's behavior and monitor for signs of fluid overload. Answer C. Report the resident's rapid fluid intake and demand to the nurse immediately, offering frequent oral hygiene. This question tests critical thinking regarding fluid balance and interdisciplinary communication. If a resident on strict fluid restriction, 1,000 ml/24 hours, has consumed 800 milliliters by breakfast, they are consuming fluids too rapidly and will significantly exceed their restriction, which is dangerous for heart failure. The most responsible action is to report their rapid fluid intake and demand for more fluids to the nurse immediately. Simultaneously, offer frequent oral hygiene, for example, moist sponge swabs, hard candies, to manage their thirst. This situation requires urgent nursing assessment and strategy adjustment. For example, you would tell the nurse, "Mr. Johnson has had 800 milliliters by breakfast out of his 1,000 milliliters limit and is demanding more fluids." Always report rapid consumption of fluid restrictions and associated distress to the nurse immediately. Question 29. A CNA observes a resident who is normally very independent suddenly exhibiting disorientation, slurred speech, and weakness on their left side. They are unable to respond to simple commands. What is the most critical action? A. Assist the resident to a comfortable position in bed and offer reassurance. B. Document the observations and monitor for changes in 30 minutes. C. Immediately report these acute neurological changes to the nurse, noting the exact time of onset, and stay with the resident. D. Offer the resident a sugary snack to see if their symptoms improve. Answer C. Immediately report these acute neurological changes to the nurse, noting the exact time of onset, and stay with the resident. This question assesses critical thinking and immediate prioritization in recognizing a medical emergency. The combination of disorientation, slurred speech, and weakness on their left side, with inability to respond to commands, are classic, acute neurological changes highly indicative of a stroke. The most critical action is to immediately report these specific, acute neurological changes to the nurse, noting the exact time of onset, which is crucial for stroke treatment protocols, and stay with the resident. This is a medical emergency where every minute counts. Other actions would dangerously delay care. Always report acute neurological changes suggestive of a stroke to the nurse immediately and stay with the resident. Question 30. A resident with a recent right hip replacement has an order for non-weight-bearing (NB) on the right leg. The CNA needs to assist them with putting on their socks and shoes. What is the safest technique for performing this task for the right leg? A. Have the resident sit upright and lift their right leg to reach their foot. B. Use a long-handled reacher to assist with sock and shoe application without bending the resident's hip. C. Ask another CNA to hold the right leg while you put on the sock and shoe. D. Instruct the resident to bend their hip and knee as needed to reach their foot. Answer: B. Use a long-handled reacher to assist with sock and shoe application without bending the resident's hip. This question tests detailed procedural knowledge for dressing a resident with specific post-operative restrictions. For a resident with a recent right hip replacement and an NWB, non-weight-bearing, order, deep hip flexion, bending at the hip, or rotation should be avoided to prevent dislocation. The safest technique for applying socks and shoes to the right leg is to use a long-handled reacher, which allows the resident to dress their foot without bending their hip or putting weight on the affected leg. Manual lifting of the leg or instructing them to bend is unsafe. Always use adaptive equipment and protect joint precautions for residents with hip replacements. Question 31. A resident on strict bed rest for several days is at high risk for deep vein thrombosis, DVT. The nurse has ordered elastic stockings, TED hose, to be worn. What is the most important specific observation the CNA should make after applying the stockings? A. That the resident's leg is warm to the touch. B. That the resident can actively move their toes. C. That the stockings are smooth, without wrinkles, and do not roll down. D. That the resident's skin color is slightly flushed. Answer: C. That the stockings are smooth, without wrinkles, and do not roll down. This question tests critical observation related to a therapeutic device for DVT prevention. After applying elastic stockings, TED hose, the most important specific observation the CNA should make is that the stockings are smooth, without wrinkles, and do not roll down. Wrinkles or rolled-down stockings can create a tourniquet effect, restricting blood flow and potentially increasing the risk of DVT or causing skin damage, rather than preventing it. The stockings must provide even graduated compression. For example, you would smooth out any creases and ensure the top band is not rolled. Always ensure TED hose are applied smoothly and correctly to be effective and safe. Question 32. What is the fundamental ethical principle that obligates a certified nursing assistant, CNA, to safeguard a resident's confidential health information from unauthorized access or disclosure? A. Beneficence. B. Justice. C. Fidelity. D. Confidentiality. Answer: D. Confidentiality. This question tests understanding of core ethical principles in healthcare. Confidentiality is the fundamental ethical principle that obligates healthcare professionals, including CNAs, to safeguard a resident's private health information, PHI, and protect it from unauthorized access or disclosure. This principle is also legally protected by HIPAA, Health Insurance Portability and Accountability Act. Breaching confidentiality erodes trust and can have legal consequences. For example, never discuss a resident's diagnosis in a public hallway. Always uphold resident confidentiality to protect their privacy and build trust. Question 33. A resident has an indwelling urinary catheter. The CNA notes pink-tinged urine in the drainage bag and the resident complains of urinary urgency. What is the most appropriate initial action? A. Document the observation and continue monitoring for clarity. B. Increase the resident's fluid intake to dilute the urine. C. Report the pink-tinged urine and urinary urgency to the nurse immediately. D. Clean the catheter site more frequently with antiseptic solution. Answer: C. Report the pink-tinged urine and urinary urgency to the nurse immediately. This question tests critical observation and reporting skills for catheterized residents. Pink-tinged urine, suggesting blood E, combined with urinary urgency are significant symptoms that can indicate a urinary tract infection, UTI, bladder irritation, or other urinary tract issues. The most appropriate initial action is to report these combined observations and symptoms to the nurse immediately for assessment. Increasing fluids without knowing the cause could be inappropriate, and CNAs do not independently increase cleaning with antiseptics. For example, the nurse might need to test the urine for blood or infection. Always report pink-tinged urine and urinary urgency to the nurse promptly. Question 34. A certified nursing assistant, CNA, observes a cognitively intact resident frequently flinching and showing fear whenever a particular staff member enters the room, even when no care is being provided. The resident avoids direct questions about the staff member. What is the CNA's most critical action? A. Document the resident's flinching and fear when that staff member is present, and report it to the nurse or supervisor immediately. B. Ask the suspected staff member directly if anything is wrong. C. Increase the frequency of observations when that staff member is in the room. D. Reassure the resident that all staff members are friendly. Answer: A. Document the resident's flinching and fear when that staff member is present, and report it to the nurse or supervisor immediately. This question addresses a critical ethical and legal responsibility, reporting suspected abuse. The keywords cognitively intact, frequently flinching and showing fear with a particular staff member, and avoiding direct questions, are strong indicators of potential emotional or physical abuse. The most critical action is to document specific observations, e.g., date, time, staff member present, resident's reaction, and immediately report this suspected abuse to the nurse or supervisor. CNAs are mandated reporters. Asking the suspected staff or merely observing further without reporting delays critical intervention. For example, you would write down exactly what you saw and who was present. Always report suspected abuse or fear reactions immediately to your supervisor. Question 35. A resident with chronic heart failure has a new order for strict intake and output, I&O, and fluid restriction. 1,200 milliliters per 24 hours. The CNA offers a resident an 8-ounce cup of ice chips, and the resident consumes all of them. How much should the CNA accurately record as intake for this item? A. 8 ounces. B. 240 milliliters. C. 120 milliliters. D. 60 milliliters. Answer: C. 120 milliliters. This question tests critical knowledge of fluid measurement, specifically for ice chips. When a resident consumes an 8-ounce cup of ice chips, the standard practice for intake and output, I&O, documentation is to record half the volume of the melted ice chips. To convert ounces to milliliters, 8 ounces * 30 milliliters per oz equals 240 milliliters. Therefore, half of the melted volume is 120 milliliters. Accurate measurement of all fluids, including ice, is critical for residents on fluid restrictions to prevent fluid overload. For example, If they ate a 4-ounce cup of ice chips, you would record 60 milliliters. Always remember to count ice chips as half their melted volume for INO. Question 36. A certified nursing assistant, CNA, is preparing to transfer a resident with a recent left hip fracture from the bed to a commode. The resident is on non-weight bearing, NB, on left leg. What is the most critical safety step before initiating the transfer? A. Ensure the commode is positioned on the resident's stronger right side. B. Lock the wheels of the commode and swing away its armrest closest to the bed. C. Have the resident try to stand independently to test their balance. D. Lower the bed to its lowest position. Answer, B. Lock the wheels of the commode and swing away its armrest closest to the bed. This question tests critical safety procedures for commode transfers, especially for residents with NWB status. The most critical safety step before initiating the transfer from bed to bedside commode is to lock the wheels of the commode and, if applicable, swing away the armrest closest to the bed. Locking the wheels prevents the commode from shifting, and swinging away the armrest removes an obstruction, making the transfer path clear and safe, significantly reducing the risk of a fall. While bed height is important, an unstable or obstructed commode is an immediate hazard during transfer. Always secure the commode and clear its path before transferring a resident. Question 37. An elderly resident with a history of hypertension and diabetes reports sudden onset of a thunderclap headache, severe and abrupt, followed by difficulty speaking and weakness on their right side. What is the CNA's immediate priority? A. Offer PRN pain medication for the headache and monitor for an hour. B. Reassure the resident and elevate the head of the bed slowly. C. Report these combined, acute neurological symptoms to the nurse immediately, noting the exact time of onset, and stay with the resident. D. Take a full set of vital signs and document them before reporting. Answer, C. Report these combined, acute neurological symptoms to the nurse immediately, noting the exact time of onset, and stay with the resident. This question tests critical thinking and immediate prioritization in recognizing a medical emergency. The combination of a sudden, severe headache, difficulty speaking, and weakness on their right side are classic, acute neurological changes highly indicative of a stroke. The immediate priority is to report these specific, acute neurological symptoms to the nurse immediately, noting the exact time of onset, which is crucial for stroke treatment protocols, and stay with the resident. This is a medical emergency where every minute counts for potential intervention. Other actions would dangerously delay care. Always report acute neurological changes suggestive of a stroke to the nurse immediately and stay with the resident. Question 38. A resident suddenly becomes unresponsive, stops breathing, and has no pulse. The certified nursing assistant, CNA, is the only staff member immediately present. What is the first and most critical action the CNA should take? A. Begin chest compressions immediately. B. Activate the emergency call system, e.g., call light, emergency button, and call for help. C. Elevate the resident's legs above their head. D. Check for a pulse for a full minute to confirm absence. Answer, B. Activate the emergency call system, e.g., call light, emergency button, and call for help. This question tests immediate, life-saving emergency response when alone. If a resident suddenly becomes unresponsive, stops breathing, and has no pulse, the first and most critical action for a CNA who is alone is to activate the emergency call system and call for help. While chest compressions are vital, calling for help alerts other staff and brings essential equipment, like a defibrillator. After calling for help, the CNA would then immediately begin chest compressions. Delaying either step is dangerous. For example, you would activate the call light and loudly shout, "Code Blue in Room X." Always activate the emergency system and call for help first when alone with a resident who is unresponsive and pulseless. Question 39. A CNA observes a resident who is typically reserved and polite now exhibiting new onset of sexually suggestive remarks and inappropriate touching of other residents, which is a significant change in behavior. How should the CNA most accurately document this observation? A. Resident is being inappropriate and needs a chaperone. B. Resident appears disinhibited, requires behavioral intervention. C. Resident noted with new onset of sexually suggestive remarks and inappropriate touching of other residents, change from baseline. Nurse notified. D. Resident is acting out due to dementia. Answer: C. Resident noted with new onset of sexually suggestive remarks and inappropriate touching of other residents, change from baseline. Nurse notified. This question tests the crucial skill of objective and detailed documentation for complex and sensitive behavioral changes. The most accurate documentation describes the specific, directly observable behaviors, new onset of sexually suggestive remarks and inappropriate touching of other residents, and clearly states that this is a change from baseline. It also includes the vital step that the nurse was notified, as such changes require professional assessment for underlying causes, for example, medical, neurological, medication side effects. Labeling the resident disinhibited or assuming dementia is subjective and diagnostic, which is outside the CNA's scope. Always document specific, objective behavioral changes, especially sensitive ones, and ensure the nurse is informed. Question 40. A resident is diagnosed with a highly resistant bacterial infection, for example, carbapenem-resistant Enterobacteriaceae (CRE), in a wound, requiring contact precautions. When removing soiled linen from the resident's bed, which personal protective equipment, PPE, is essential for the certified nursing assistant, CNA, to use? A. Sterile gloves and a surgical mask. B. Gown and gloves. C. N95 respirator mask, gown, and gloves. D. Gloves only. Answer: B. Gown and gloves. This question tests critical knowledge of infection control, specifically essential PPE for highly resistant bacterial infections. CRE, carbapenem-resistant Enterobacteriaceae, typically requires contact precautions due to its easy spread through direct contact with the resident or contaminated surfaces/items. When removing soiled linens, which are heavily contaminated, the essential PPE includes a gown, to protect clothing from splashes and contamination, and gloves, to prevent direct contact with infectious material. These barriers protect the CNA from the bacteria. Sterile gloves are unnecessary, and an N95 mask is for airborne pathogens. For example, you would don a gown and gloves before entering the room to strip the bed. Always wear a gown and gloves when handling soiled linens from a resident on contact precautions for resistant bacteria. Question 41. A resident with severe visual impairment relies on auditory cues and a consistent environment. The facility is undergoing renovations, causing frequent changes in furniture placement and new loud noises in the hallway. What is the CNA's most therapeutic intervention to minimize resident agitation and maximize safety during this period? A. Place the resident in their room with the door closed and provide headphones. B. Limit the resident's movement outside their room to avoid new obstacles. C. Communicate all upcoming changes calmly, describe the environment, offer increased guidance, and advocate for minimal disruption to their personal space. D. Reassure the resident that the renovations will be finished soon. Answer C. Communicate all upcoming changes calmly, describe the environment, offer increased guidance, and advocate for minimal disruption to their personal space. This question addresses holistic care for residents with severe sensory impairments in a changing environment. When a resident with severe visual impairment and profound hearing loss is impacted by renovations, the most therapeutic intervention is comprehensive. This includes calmly communicating all upcoming changes, describing the altered environment, offering increased guidance and support for ambulation, and actively advocating for minimal disruption to their personal space. This proactive, person-centered approach provides predictability and security, reducing agitation and maximizing safety during a stressful period. Simply isolating them or giving vague reassurances is insufficient. Always prioritize clear communication, increased support, and environmental consistency for residents with sensory impairments during changes. Question 42. When providing oral care for a resident who has severe oral thrush, fungal infection in the mouth, and very fragile oral mucosa, what is the most important modification the CNA should make? A. Use a commercial mouthwash with alcohol for effective disinfection. B. Brush teeth and gums vigorously to remove fungal buildup. C. Use only a soft sponge swab, apply prescribed topical antifungal medication gently, and observe for bleeding. D. Skip oral care to avoid irritating the thrush. Answer C. Use only a soft sponge swab, apply prescribed topical antifungal medication gently, and observe for bleeding. This question tests adapting personal care for a specific and sensitive oral health condition. For a resident with severe oral thrush and very fragile oral mucosa, the most important modification for oral care is to use only a soft sponge swab, apply any prescribed topical antifungal medication very gently, and observe carefully for bleeding. Thrush makes the mouth very sensitive and prone to bleeding. Alcohol-based mouthwashes would be irritating, vigorous brushing is too harsh, and skipping care compromises healing and hygiene. For example, you would gently wipe their mouth with a soft swab dipped in water, then apply the prescribed Nystatin. Always use gentle techniques and apply prescribed medications for oral thrush. Question 43. A resident with a gastrostomy tube, G-tube, used for feedings is experiencing severe projectile vomiting and has visible gastric contents around the tube site. The feeding is currently infusing. What is the CNA's immediate and most critical action? A. Clean the area around the G-tube site with a clean cloth. B. Stop the feeding immediately, position the resident to prevent aspiration, and report to the nurse. C. Administer a PRN anti-nausea medication via the G-tube. D. Check the tube for kinks and clogs. Answer B. Stop the feeding immediately, position the resident to prevent aspiration, and report to the nurse. This question tests critical emergency intervention for a resident with a feeding tube experiencing severe complications. Severe projectile vomiting and visible gastric contents around the tube site while feeding is infusing indicate a serious problem like a tube dislodgement, obstruction, or severe intolerance, with an extremely high risk of aspiration. The immediate and most critical action is to stop the feeding immediately, position the resident to prevent aspiration, for example, turn to side, elevate HED, and report these critical observations to the nurse without delay. Administering medication or simply cleaning is insufficient. For example, you would clamp the feeding tube and immediately assist them to a safe position to prevent choking. Always stop tube feedings, ensure aspiration prevention, and report severe vomiting/leakage to the nurse immediately. Question 44. A resident, normally calm and oriented, suddenly becomes disoriented, agitated, and attempts to pull out their 4-line and Foley catheter. What is the CNA's most therapeutic and safe first step? A. Immediately apply soft limb restraints to prevent removal of tubes. B. Firmly tell the resident to stop pulling the tubes and lie still. C. Gently redirect the resident's hands away from the tubes, assess for pain or immediate needs, and report the acute change in mental status to the nurse. D. Document the behavior and ensure the tubes are taped down more securely. Answer: C. Gently redirect the resident's hands away from the tubes, assess for pain or immediate needs, and report the acute change in mental status to the nurse. This question addresses managing acute changes in mental status and protecting medical devices. When a normally calm and oriented resident suddenly becomes disoriented, agitated, and attempts to pull out their 4-line and Foley catheter, the most therapeutic and safe first step is to gently redirect their hands away from the tubes, assess for any immediate needs, for example, pain, full bladder, that might be causing distress, and then report the acute change in mental status to the nurse immediately. This behavior could indicate a new infection, medication reaction, or other acute condition. Restraints are a last resort and require a nurse's order. Always prioritize immediate safety and report acute changes in mental status and attempts to remove medical devices to the nurse. Question 45. While taking a resident's vital signs, the CNA notes the resident's respirations are very shallow, labored, and rapid at 32 breaths per minute, with noticeable nasal flaring. The resident also appears pale. What is the CNA's immediate priority? A. Document the respiratory findings and continue with other vital signs. B. Reassure the resident and encourage them to breathe slower. C. Report the respiratory distress, tachypnea, labored breathing, nasal flaring, and pallor to the nurse immediately. D. Administer supplemental oxygen if available in the room. Answer: C. Report the respiratory distress, tachypnea, labored breathing, nasal flaring, and pallor to the nurse immediately. This question tests critical thinking and immediate intervention for severe respiratory distress. The combination of shallow, labored, and rapid at 32 breaths per minute, tachypnea, nasal flaring, and pale appearance are all strong signs of acute respiratory distress or compromised oxygenation. The immediate priority is to report these combined, critical observations to the nurse without delay. This is a medical emergency requiring urgent professional assessment and intervention. CNAs do not administer oxygen, and simply documenting or trying to slow breathing is insufficient. Always report signs of severe respiratory distress immediately to the nurse. Question 46. A new resident is admitted who has moderate cognitive impairment and expresses significant anxiety about leaving their spouse at home, repeatedly asking, "Is he okay?" What is the CNA's most therapeutic approach during the initial admission process? A. Gently explain that their spouse is fine and to focus on settling in. B. Offer to call their spouse on the resident's behalf. C. Validate their anxiety, it's natural to worry, offer a reassuring presence, and suggest the nurse can help facilitate a call or update later. D. Document the anxiety and encourage them to unpack their belongings to distract them. Answer: C. Validate their anxiety, it's natural to worry, offer a reassuring presence, and suggest the nurse can help facilitate a call or update later. This question addresses person-centered care and managing anxiety during admission for a resident with cognitive impairment. When a new resident expresses significant anxiety about leaving their spouse, the most therapeutic approach is to validate their anxiety, for example, it's natural to worry about loved ones, offer a calming presence, and suggest that the nurse can help facilitate a call or update later once they are settled. This acknowledges their emotional distress and provides a plan without dismissing their feelings. Making promises or offering to call independently is not the CNA's role. For example, you might gently sit beside them and say, "I understand you're worried. Let's get you comfortable, and the nurse can help you connect with your husband later." Always validate anxieties and offer appropriate reassurance and support during admission. Question 47. A CNA needs to move a completely dependent resident weighing 180 pounds up in bed. What is the safest and most appropriate method for this task? A. One CNA using a draw sheet. B. Two CNAs using a draw sheet. C. A mechanical lift with one CNA. D. Two CNAs manually lifting without a draw sheet. Answer: B. Two CNAs using a draw sheet. This question tests critical knowledge of safe patient handling techniques. For a completely dependent resident weighing 180 pounds who needs to be moved up in bed, the safest and most appropriate method is to use a draw sheet with the assistance of two CNAs. The draw sheet reduces friction and allows the CNAs to lift and move the resident smoothly without dragging, minimizing the risk of skin shearing and injury to both the resident and staff. One CNA alone is insufficient, and manual lifting without a draw sheet increases injury risk. For example, both CNAs would stand on either side, grasp the draw sheet, and on the count of 3, lift and slide the resident up. Always use a draw sheet and two CNAs for moving dependent residents up in bed. Question 48. During a routine skin check, the CNA observes a resident's sacrum has a pressure injury that is deep, with visible bone exposed, and some tunneling. The resident reports severe pain. What is the most accurate classification of this finding? A. Stage 2 pressure injury. B. Stage 3 pressure injury. C. Stage 4 pressure injury. D. Unstageable pressure injury. Answer: C. Stage 4 pressure injury. This question tests advanced knowledge of skin assessment and pressure injury classification. The description of a pressure injury as deep, with visible bone exposed, and some tunneling is the definitive sign of a stage 4 pressure injury. Stage 4 involves full-thickness tissue loss with exposed bone, tendon, or muscle. Tunneling, a channel extending from the wound into deeper tissues, and exposed bone are clear indicators of this most severe stage. This is a critical finding that needs immediate reporting to the nurse for urgent assessment and intervention. Always recognize exposed bone, tunneling, or muscle as a stage 4 pressure injury. Question 49. A resident with severe visual impairment and a history of frequent falls needs to ambulate to the dining room using a rolling walker. The CNA is assisting. What is the most critical safety action the CNA must perform continuously throughout the ambulation? A. Frequently remind the resident to look straight ahead. B. Walk several feet ahead, calling out obstacles. C. Maintain a secure hold on a gait belt and scan the path ahead for hazards. D. Ensure another CNA is walking behind with a wheelchair. Answer: C. Maintain a secure hold on a gait belt and scan the path ahead for hazards. This question addresses critical, continuous safety for a highly vulnerable resident during ambulation. For a resident with severe visual impairment and frequent falls using a walker, the most critical safety action is for the CNA to maintain a secure hold on a gait belt and actively scan the path ahead for hazards. This combines direct physical support, via the gait belt, with proactive environmental awareness, which is crucial for preventing falls caused by unseen obstacles. Simply reminding the resident or walking ahead is insufficient for such high risk. For example, you would firmly grasp the gait belt, continuously looking for changes in the floor or objects, and gently guide them. Always maintain a secure grip and actively scan the environment for high fall risk residents during ambulation. Question 50. A resident has a new abdominal surgical incision with a dressing. The CNA is assisting the nurse with the first sterile dressing change. After the nurse has donned sterile gloves, what is the CNA's role when retrieving additional sterile gauze for the nurse? A. Open the outer wrapper of the sterile gauze package and hand the nurse the sterile gauze directly. B. Open the outer wrapper of the sterile gauze package and hold the inner sterile packaging for the nurse to grasp the gauze. C. Place the sterile gauze directly onto the sterile field established by the nurse. D. Put on sterile gloves themselves and hand the gauze to the nurse. Answer B. Open the outer wrapper of the sterile gauze package and hold the inner sterile packaging for the nurse to grasp the gauze. This question tests advanced knowledge of assisting with sterile procedures and maintaining the sterile field. When assisting a nurse with a sterile dressing change, and the nurse has donned sterile gloves, the CNA, who is not sterile, should open only the outer wrapper of the sterile gauze package. Then, the CNA holds the inner sterile packaging in such a way that the nurse can grasp the sterile gauze without the CNA's non-sterile hands or clothing contaminating the sterile contents or the sterile field. This prevents a breach of sterility. Placing items directly onto the field or donning sterile gloves, which CNAs don't typically do for this role, is incorrect. For example, you would peel back the paper of the gauze package and hold it open for the nurse. Always present sterile items to the nurse so they can grasp them without contaminating the sterile field. Question 51. A resident with a gastrostomy tube, G-tube, is due for intermittent feeding. The CNA has aspirated 180 milliliters of residual stomach contents, which exceeds the facility's policy limit of 150 milliliters. The resident is also reporting slight nausea. What is the CNA's most appropriate action? A. Discard the 180 milliliters residual and administer the feeding. B. Administer 150 milliliters of the aspirated residual back, discard the remaining 30 milliliters, and then administer the feeding. C. Return the 180 milliliters residual to the stomach, hold the feeding, and report the excessive residual and nausea to the nurse immediately. D. Reduce the ordered feeding volume by 30 milliliters to compensate for the excessive residual. Answer C. Return the 180 milliliters residual to the stomach, hold the feeding, and report the excessive residual and nausea to the nurse immediately. This question tests critical safety protocols for tube feeding management. If the residual stomach contents aspirated exceed the facility's policy limit, 180 ml aspirated versus 150 milliliters limit, and the resident has slight nausea, it indicates delayed gastric emptying and an increased risk of aspiration. The most appropriate action is to return the entire 180 milliliters residual to the stomach, to prevent electrolyte imbalance, hold the scheduled feeding, and immediately report the excessive residual and nausea to the nurse. Discarding any residual or adjusting feeding volumes is inappropriate. The nurse needs to assess the resident and determine if the feeding order needs adjustment. Always return excessive gastric residuals, hold the feeding, and report to the nurse immediately, especially with nausea. Question 52. When providing post-mortem care for a resident whose family has requested a special religious ritual involving a specific burial shroud, what is the CNA's most appropriate action? A. Politely inform the family that facility standard shrouds are used for all residents. B. Offer to apply the family's specific burial shroud, ensuring it is done respectfully and documented. C. Document the family's request and report it to the nurse, who will coordinate with the family and funeral home. D. Suggest the family perform their rituals after the body has left the facility. Answer C. Document the family's request and report it to the nurse, who will coordinate with the family and funeral home. This question addresses cultural and religious sensitivity in post-mortem care. When a family expresses a special religious request regarding a burial shroud, the most appropriate action is to document the family's request and immediately report it to the nurse. The nurse will then coordinate with the family and the funeral home to determine how best to accommodate the religious and cultural needs within facility policies and legal guidelines. CNAs do not independently decide on special shrouds. This requires nursing and family coordination. For example, the nurse might instruct you on how to prepare the body according to religious customs. Always report family religious requests in post-mortem care to the nurse for appropriate coordination. Question 53. A resident on a consistent carbohydrate diet, diabetic diet, consistently tries to eat high-sugar items brought in by visitors, leading to fluctuating blood sugar levels. What is the CNA's most therapeutic and safe intervention? A. Physically prevent the resident from accessing visitor-brought foods. B. Inform visitors that they cannot bring any outside food for the resident. C. Gently redirect the resident, explain the importance of their diet, offer an approved diabetic snack, and report visitor noncompliance to the nurse. D. Allow the resident to have a small amount of the sugary item to avoid agitation. Answer C. Gently redirect the resident, explain the importance of their diet, offer an approved diabetic snack, and report visitor noncompliance to the nurse. This question addresses balancing resident choice with strict dietary needs and visitor education. When a resident on a consistent carbohydrate diet consistently tries to eat high-sugar items brought by visitors, the most therapeutic and safe intervention is to gently redirect the resident, calmly explain the importance of their diet, and immediately offer an approved diabetic snack. Crucially, the CNA must also report visitor noncompliance to the nurse, who can then educate the visitors on appropriate food items. For example, you might say, "Mr. Smith, this cake is not good for your diabetes, but I have a sugar-free pudding for you." Always redirect and offer safe alternatives, and report visitor noncompliance to the nurse. Question 54. When performing a resident's daily weight measurement, the CNA notices that the resident is becoming dizzy and lightheaded while standing on the scale. What is the CNA's immediate action? A. Encourage the resident to hold still to get an accurate reading. B. Immediately assist the resident to a sitting or lying position to prevent a fall. C. Document the dizziness and weight, then report it later. D. Call for another CNA to quickly assist with holding the resident steady. Answer B. Immediately assist the resident to a sitting or lying position to prevent a fall. This question tests immediate safety intervention during a routine measurement. If a resident is becoming dizzy and lightheaded while standing on the scale, it indicates orthostatic hypotension or another cause of instability. The immediate action is to immediately assist the resident to a sitting or lying position to prevent a fall, which could result in serious injury. Getting an accurate weight is secondary to resident safety in this moment. Calling for another CNA or simply documenting without intervention delays critical safety. For example, you would quickly help them sit back onto a chair or lower them to the floor. Always prioritize resident safety by assisting them to a stable position if they become dizzy or unsteady during weighing. Question 55. A resident with hearing aids consistently reports poor hearing and frustration, even after the certified nursing assistant, CNA, has checked the battery, cleaned the ear mold, and reseated the aide. What is the CNA's most appropriate next action? A. Assume the resident's hearing has worsened and speak louder. B. Document the persistent hearing difficulty and frustration, and report it to the nurse for further assessment. C. Turn the hearing aid volume up to maximum and encourage the resident to try harder. D. Advise the resident that they may need a new hearing aid. Answer B. Document the persistent hearing difficulty and frustration, and report it to the nurse for further assessment. This question addresses advanced troubleshooting for assistive hearing devices and recognizing when to escalate. If a resident reports poor hearing and frustration, and the CNA has performed basic troubleshooting, battery, cleaning, reseating, the most appropriate next action is to document the persistent hearing difficulty and frustration, and report it to the nurse for further assessment. This indicates a problem, for example, earwax impaction deep in the canal, internal aid damage, need for audiology consult, or worsening hearing loss, that is beyond the CNA's scope to fix. For example, you would secure the hearing aid and tell the nurse, Mrs. Smith's hearing aid still isn't helping her hear, and she's very frustrated, even after I checked the battery and cleaned it. Always report persistent issues with hearing aids and resident frustration to the nurse for further assessment. Question 56. A resident with an advanced Directive 4 DNR/DNI, do not resuscitate/do not intubate, is found unresponsive, not breathing, and without a pulse. What is the CNA's immediate action? A. Immediately begin chest compressions and rescue breaths. B. Call for the nurse to verify the advanced directive before taking action. C. Activate the emergency call system and alert staff to the situation, stating no CPR/DNR/DNI. D. Initiate rescue breaths only, as intubation is prohibited. Answer C. Activate the emergency call system and alert staff to the situation, stating no CPR/DNR/DNI. This question tests crucial knowledge of advanced directives and emergency response. If a resident with a DNR/DNI order is found unresponsive, not breathing, and without a pulse, the immediate action is to activate the emergency call system, for example, call light, emergency button, and alert staff to the situation, explicitly stating no CPR/DNR/DNI. This respects the resident's legal right to refuse life-sustaining treatment. While calling for help is vital, initiating CPR or rescue breaths would violate the advanced directive. For example, you would activate the call light and loudly state, resident unresponsive, no CPR per DNR/DNI order in room X. Always activate the emergency system and alert staff, but respect DNR/DNI advanced directives by not initiating resuscitation. Question 57. A resident is transferred to your unit and has an order for orthostatic vital signs bid, twice daily. When taking the blood pressure in the lying position, the resident reports feeling dizzy. What is the CNA's immediate action? A. Instruct the resident to sit up slowly and then stand. B. Continue with the lying blood pressure, reassuring them it's normal. C. Immediately assist the resident to lie back down, and report the dizziness to the nurse before proceeding with other positions. D. Skip the rest of the orthostatic vital signs for the day. Answer C. Immediately assist the resident to lie back down, and report the dizziness to the nurse before proceeding with other positions. This question tests critical safety during vital sign measurement. If a resident reports feeling dizzy while taking orthostatic vital signs in the lying position, or any position, the immediate action is to immediately assist the resident to lie back down to prevent a fall or worsening dizziness. Concurrently, report the dizziness to the nurse before proceeding with other positional measurements. This prioritizes resident safety over completing the full set of vital signs. For example, if they become dizzy while lying, you would gently help them lie flat and then find the nurse. Always prioritize resident safety and report dizziness to the nurse immediately during orthostatic vital sign checks. Question 58. When making an occupied bed for a resident who is confused and resistive to touch, after raising the bed to a comfortable working height and ensuring the opposite side rail is up, what is the next most appropriate safety step for the CNA? A. Ask the resident firmly to cooperate with the bed making. B. Provide perineal care while the resident is still wet. C. Use a calm, reassuring tone, explain each step simply, and gently roll the resident away from you. D. Quickly pull all soiled linen from under the resident. Answer: C. Use a calm, reassuring tone, explain each step simply, and gently roll the resident away from you. This question tests person-centered care and safety for a confused and resistive resident during occupied bed making. After initial safety steps, the most appropriate action is to use a calm, reassuring tone, explain each step simply, and gently roll the resident away from you onto their side. This approach minimizes agitation and resistance by providing clear, gentle communication and careful handling. Forcing care or quickly pulling linen is unsafe and disrespectful. For example, you would gently touch their arm and say, "I'm just going to help you roll to your side now, Mrs. Green." Always use calm communication and gentle handling for confused or resistive residents during care. Question 59. A resident's son expresses concern that his father, who has a cognitive impairment, is refusing to wear his culturally significant religious cap, kippah or yarmulke, which he always used to wear. What is the CNA's most appropriate action? A. Inform the son that the resident is simply confused and cannot make that choice. B. Attempt to place the cap on the resident, explaining its importance. C. Document the son's concern and report it to the charge nurse, exploring ways to reintroduce or offer the cap gently. D. Suggest the son try to convince his father to wear it. Answer: C. Document the son's concern and report it to the charge nurse, exploring ways to reintroduce or offer the cap gently. This question addresses cultural competence and person-centered care for residents with cognitive impairment. When a family expresses concern about a resident refusing a culturally significant religious cap, the most appropriate action is to document the son's concern and report it to the charge nurse. The nurse can then explore strategies to gently reintroduce or offer the cap, considering the resident's cognitive state and past preferences, respecting cultural identity without causing distress. Forcing it or dismissing the concern is inappropriate. For example, the nurse might suggest offering the cap during a calm period or incorporating it into a familiar routine. Always advocate for residents' cultural and religious needs by reporting concerns to the nurse. Question 60. A cognitively impaired resident has a new Order 4 bed alarm for fall prevention due to increased attempts to get out of bed independently. The resident consistently removes the alarm sensor from their bed. What is the CNA's most appropriate proactive intervention to ensure safety? A. Apply soft limb restraints to the resident at bedtime. B. Continuously reposition the resident in the center of the bed away from the sensor. C. Increase frequency of rounds and scheduled toileting, and explore alternative alarm types, for example, chair alarm, pressure mat on floor. D. Tell the resident sternly that the alarm is for their safety and must stay on. Answer: C. Increase frequency of rounds and scheduled toileting, and explore alternative alarm types, for example, chair alarm, pressure mat on floor. This question addresses proactive, person-centered interventions for fall prevention when a bed alarm is ineffective for a cognitively impaired resident. If a resident consistently removes the alarm sensor, The most appropriate proactive intervention is to increase the frequency of rounds and scheduled toileting to address underlying needs, for example, needing to void restlessness. Concurrently, report the issue to the nurse to explore alternative alarm types like a chair alarm or a pressure mat on the floor, which might be harder for the resident to remove. Restraints are a last resort and often increase agitation. For example, you would check on them every 30 minutes, offer the bathroom, and discuss different alarm options with the nurse. Always combine increased monitoring and problem-solving with alternative strategies when a bed alarm is ineffective.